some of the symptoms associated with dehydration. And so I will say this too, there have been a number of research studies. Hydration's a funny thing. It's been being studied for years and years and years. And we still don't know everything that we need to know about hydration and water, but I want to give you some fundamental basics, right? So what we see in people with dehydration, okay, common symptoms of mild to moderate. Key here, mild to moderate. Okay, so mild to moderate dehydration are dry mouth, tongue, thirst, headaches. There's actually been studies that show that headaches, including migraine headaches, are improved dramatically when people just stay hydrated. Lethargy or fatigue, okay, dry skin, muscle weakness. So again, strength training, if you feel like you're getting weaker, lightheadedness is a very common symptom, dizziness, and a lack of focus. This is all just the early stages potentially of dehydration, and this can happen very quickly. Folks, like you could go and you could exercise aggressively and sweat really aggressively, be mildly dehydrated for the rest of the day. So if you find yourself, after your exercise, you're tired, you're dizzy, you can't focus or concentrate, you may be looking at your hydration as playing a potential role in this, especially if you're a heavy sweater. Okay. Now, some of you may say, I don't sweat at all, and some of you may be heavy sweaters. It's one or the other in my experience. And so if you're a heavy sweater, when you do your exercise, if you're pouring, okay, if you're that person that leaves the pool on the equipment after you get up, right, this is something you want to think about, especially if you're struggling, with headache, lethargy, brain fog, fatigue, dizziness, those types of symptoms for the rest of the day after your exercise. Now, with severe dehydration, symptoms can be even worse, right? So we get kind of greater degrees of dehydration, can present with sunken eyes, lack of tears. In other words, you can't produce them very effectively. Sunken fontanelles, it's the areas on the side of the head. Hypotension, which is low blood pressure. So again, in this case, it's the opposite. You actually get hypotension with tachycardia, which is an elevation in heart rate. So heart pounding, heart racing. Again, this is severe dehydration. This is late stage. This is, potentially you're going to need to be in the hospital and be IV'd to regain it. And then again, worst case scenario, you pass out and potentially run the risk of dying. So hopefully none of you are experiencing this. And if you are, you're in the right medical care. But it's these other ones that most of you might come across or might experience. And so these are very common symptoms. Dry skin, muscle weakness, lightheadedness, dizziness, very, very common. Brain fog and lack of focus. So again, if you struggle in that regard and you're suspecting that you might not be getting enough water, then you really want to think about, how better to hydrate yourself. So let's talk next. Actually, we'll give you kind of two elements here. So according to the Institute of Medicine, we're talking about how much water should a person drink. Okay, so if we're talking about the average person, the general recommendation is almost 4 liters a day, 3.7 liters per day, okay? And that's for men, generally speaking, and then we have 2.7 liters per day for women, okay? So if this is for men, this is for women, and this is generally the, 154 pounds, somewhere in that neighborhood, 70 kilograms. So do the math accordingly. So again, 3.7 liters, which is, understand there's approximately 4 8-ounce cups in 1 liter. So if you're doing the math in that way, that basically equates to, men 15.5 cups is getting 8 ounces, and then women 11.5 cups. Those are 8-ounce glasses or 8-ounce cups. So problem with that is not everybody's the same, right? Not everybody needs that much water, and some people may need more depending on who they are. And so there are factors involved with hydration that have to be considered. And one of the factors when it comes to drinking water is, let's change the color here. One of the factors is how much do you sweat? So again, what I was saying earlier about heavy sweating. Another factor is your size, your weight. Another factor would be your exercise. Another factor would be your diet, what you eat. And the reason why in your diet, if you eat packaged processed foods, those are largely foods that are dehydrated. They have lower water content. But if you're eating fresh, okay, so if your diet is fresh, you're actually getting quite a bit more water. So you increase your water when you eat fresh food. You decrease your water when you eat packaged foods. Packaged foods typically a lot lower in total water content. So if you're eating a lot of veggie, even if you're eating, freshly cooked meats, there's going to be a large percentage. Remember what I said earlier, muscle is 80% water. When you're cooking that meat, there's a lot of water in it. So you're getting quite a bit of water from the solid foods that you're eating. So don't forget that, because a lot of people do this. They'll sit there and they'll run to the bathroom. They'll try to get to this level, right? This 15.5 cups a day. And they'll spend the majority of the day running to the bathroom, right? They'll be finding themselves urinating, 8, to 12 plus times a day. And that can interfere with your quality of life, but it also could be too much because you can overdrink too. And so remember, if you overconsume water, you can actually hyperhydrate. If you hyperhydrate, you can actually dehydrate yourself depending on the type of water that you're drinking. And we'll talk more about that in just a minute as well. So hyperhydration can be a problem as well. You can overdo it. And so that can create some of the health issues in and of itself. So again, don't think you need to exactly look at these things here. Now, other things that we might consider with water, if we're going off it, so we got, 1 is sweat, 2 is size, 3 is exercise, 4 is diet. Number 5, I would say, is your thirst mechanism, listening to your thirst mechanism. Now, there's some research studies that show that by the time you're thirsty, you're already dehydrated. We've actually seen a number of military studies where they're studying soldiers, and so by the time they're actually thirsty, they're already dehydrated. But that being said, you still have to look at thirst as a mechanism, and you have to think about things that can increase thirst. So there are certain diseases that can increase thirst, and diabetes is a big one. So if you are high blood sugar, one of the side effects of too much sugar in your bloodstream is it increases the thirst mechanism, right? So it makes you more thirsty. But thirst, you should also remember there's an intuitive intelligence that your body has. We can study these things all day long in science, but if we fail to listen to the message that our body's trying to deliver to us, then we failed, right? So listening to your body, listening to your thirst mechanism. And so this sometimes, again, by the time you're thirsty, you may already be dehydrated. But learn how to pay attention and learn how to be intuitive with your body. So again, you have to take into consideration all these parameters, okay, and be intelligent about how you consume your water. And don't just think, I need to follow this 15.5 cups a day, because if you're a sedentary couch potato, but you have a good diet with a lot of fresh food and you don't exercise very much and you're a small person and you don't sweat a lot, you might not need 15.5 cups a day. So again, the way I like to judge it, clinically speaking, and it's worked really, really well for my patients, is a lot of times we look at these different factors, okay? But then we also look at how many times they're going to the restroom in the course of a day. We also sometimes we ask the question about bladder anatomy. Some people have small bladders, and hydration doesn't have a whole lot to do with this per se. So again, if a person has a very small bladder and they find themselves having to go to the bathroom very, very frequently, we may not be able to use this in our calculation. So bladder anatomy, very important. But normal bladder, small bladder aside, person having a normal bladder, 6 to 8 times a day is a good amount if they're full urine voids without the influence of diuretics. And remember, what are the most common diuretics that people get exposure to? Aside from blood pressure medicines, caffeine. Caffeine is a big one as far as affecting the water balance. So if you drink a lot of caffeine, a lot of coffee, teas, and things of that nature, you have to also consider that this is a diuretic and can increase this number here. But 6 to 8 is a good number of times to basically let your kidneys flush out the toxins from your body, because remember, one of the functions of urination is to excrete toxins, which is why we want to stay hydrated. We want to have enough water to hit this level, but we don't want to have so much that we're actually causing dehydration, because water is also a diuretic. Remember, the more you drink, the more you pee, and same thing with caffeine and caffeinated beverages. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.